Okay, next case from Surgical Pathology Atlas. It's another a rare and a strange case. It's basically a 70 years old man who was found to have an enlarged groin lymph node. Due to the size of that lymph node, it was excised and it was sent to us for pathological evaluation, also with a requisition to evaluate for lymphoma. So when we looked at the slides, basically one thing is obvious is that it is not a lymphoma. It is basically a soft tissue tumor arising into the subcutaneous fat. There is no skin or any lymphoid tissue adjacent to it. The lesion, as you see, has a pushing border right here. It has a marked fibrosis in it, like this one, collagenous deposits. And you can see that in areas like this one, for example, there is a central necrosis. So it has this a nodular look to it. And to some degree on this magnification even resembles, a granuloma. You can see here, this is a very well demarcated, very nodular appearing with a central necrosis. And there is some vascular ectasia around it. So let's look at the tissue now. Okay, and again, let's focus on this area. Again, nodular appearance, pushing border, central necrosis. Okay, and it's a very cellular specimen. The cells by themselves are very epithelioid looking, right here. They have this a small prominent nucleolus, very clear chromatin, and very pale eosinophilic cytoplasm. And this is the central necrotic area right here. So let's look at these cells at a 40x. So basically these are the cells, very pale. Some have this nuclear chromatin clearing, prominent cherry red nucleoli, and also the lesion shows this very dense, almost like a keloid-like type of collagen dissecting this lesion. Okay, so when you see that there are many differentials which one may include in this differential, basically all sorts of sarcomas come into play. It was basically an accidental finding. Definitely it's a malignancy. Look at the nuclear polymorphism, irregular chromatin, and sizes and shapes of these cells. So we decided to do a panel of immunohistochemical stains, to rule out things like a proliferative fasciitis, nodular fasciitis, different types of sarcomas, and so and so and so. Now, the one thing you also want to see are this thing. Okay, so these are mitotic figures. In this particular case, there are about 5 to 10 mitotic figures per high power field, and they were counted in a couple of blocks. There are some abnormal mitotic figures, like a tripolar mitosis, were also observed. You can see that there are 2 only on this field. There are 2 mitotic figures. Also, we have a individual cell apoptosis, and you can see this here represents a karyorectic debris, and there are some capillary loops running along this entity. So the set of immunostains we did, was pancytokeratin. In this case, it was strongly positive. Then we did EMA, which was a strongly positive. We did vimentin, which also was strongly positive. CD34, strongly positive. Negative for desmin, negative for S100. So this immunoprofile, along with the typical look of granuloma, a nodular lesion, epithelioid lesion with central necrosis, makes the diagnosis of epithelioid sarcoma. So this is a rare case of epithelioid sarcoma arising in the groin of elderly men.